Knock, knock, knock.
Come in.
Hi, Paul. I'm Jennifer. I'm going to be your nurse today. How are you?
Good, how are you?
Good. I understand you're not feeling well today. Is that right?
No.
Okay. Can I check your name and wristband, and we'll get into that in a second?
Yeah.
What's your name and date of birth?
Paul Wilson, April 17th, 1970.
Okay, thank you. First, I'm going to assess the room to make sure that it's clean. And no, there's no hazards. Your hospital bed is at the lowest position, and the wheels are locked. I'm going to make sure you have your call light and your water. And just take a general survey, make sure there's no tripping hazards and things like that. Can you tell me what year it is?
It's 2020,
Okay, and what's the date today?
April 28th, I think.
That's right. Okay. And how are you feeling? What are you in the hospital for?
I think I have food poisoning.
You have food poisoning?
Yes.
I'm sorry to hear that. Can you tell me a little bit more about that? What's your pain on a scale of 1 to 10?
Oh, maybe 7 or 8.
7
It's
or
pretty
8?
bad.
Okay. Can you describe the pain? Is it dull? Is it sharp? Is it
I have
crampy?
a sharp pain under my left rib and then dull pain all through my lower abdomen
Okay.
that radiates out to my back.
Okay. And then can you tell me when did this pain start?
Yesterday, after I ate some potato salad, a couple hours after.
A couple hours after you ate some potato salad yesterday.
Yeah.
So what time did you eat potato salad?
I think it was a 9.
9 o'clock, and so by 10 or 11,
Right.
11 o'clock at night, you started feeling sharp pains, crampy pains. Okay. And then can you point to where it is on your stomach?
Just right.
Can you make sure the camera can see? Okay.
Right here and then under my rib right here.
Okay. And then when does it get worse?
After I eat or drink anything.
Okay. And then what makes it feel better?
Whatever they gave me,
The Zofran?
the Adrilfran, that's it.
Okay.
And then just kind of curling up in bed in a ball. I feel
Okay.
better, a little better.
And you said it radiates into your back?
Yeah.
Okay. Anywhere else?
No.
Okay. And then what are some associated symptoms from that? Do you have any associated symptoms related to this? How is it affecting your life right now? Are you able to do anything?
Oh no, I can't do anything up
Can't
in
do
bed.
anything?
Yeah.
Okay. All right. Well, let's go over your diagnostics that they have pending for you. They have a CBC pending, an SMA 21, and they're going to take you for an ultrasound in an hour, an abdominal ultrasound. And I understand you're not supposed to be eating anything or drinking anything right now until then. Is that right?
Yes.
Okay. Your blood pressure is 139/70, slightly high. Is that normal for you?
No, it's usually lower than that.
Okay. And then your temperature is 100.2. That's a little high. And your heart rate is 93. Respiratory rate's 24. Last they checked. And your oxygen was pretty low at 92 on room air. Okay, I can see that the patient is able to talk to me. So he's A&O times 4. He appears to be clean. His hair is clean. His clothing is relatively clean. And so he's A&O times 4. So now, Paul, let's go back to your chart. Can you look at your chart for me and confirm that your name is spelled right, your birthday's correct, and all of that information on the top?
Yes.
3 lines, okay. And then it shows here that you have had a flu shot in 2019, and that you had all of your childhood immunizations. You had a Hep B booster last year in 2019, and you had varicella or chickenpox in 1980. Is that correct? Okay, as far as childhood illnesses, it shows here that you had measles. Is that correct? And you haven't had mumps, rubella, or scarlet fever. And we already talked about chickenpox. Have you ever had shingles?
No.
And have you ever had a tetanus shot? Have you had one in the last 5 years?
Yes.
Okay, let me add that to your chart. You've had one in the last 5 years. Okay. All right, and then it shows for your medical diagnosis, you had a broken wrist about 5 years ago.
Yes.
And today you think you have food poisoning, correct? And allergies, you don't have any known drug allergies, is that correct?
No.
Have you ever had any allergies to food?
No.
Okay, or cats or tape, like latex gloves or medical tape? Okay. And your current medications, you're taking an over-the-counter vitamin, Are you taking any herbal supplements?
No.
Okay. And you're also taking the medicine for your nausea, correct?
Yes.
And you've never been in the hospital before. That's
No.
quite remarkable. But you did break your wrist 5 years ago, and you had surgery on that. All right. Any other surgeries you've had? No
No.
hospital stays?
No.
Okay, let's move on to your family medical history. I'm sorry that your mother died of cancer, lung cancer at 62.
Mm-hmm.
That's really young. I'm so sorry. And your father's alive and well,
Yes.
and you don't have any siblings.
No.
Okay, only child. Is there anything else about your medical history that might be pertinent to your abdominal area?
My dad had Crohn's disease, or has Crohn's disease.
Your dad has Crohn's disease?
Uh-huh.
Okay. That could be related. There is a slight genetic link with that. Let's talk about your family and your social support. Who do you live with right now?
My wife and kids.
Okay. Are they, what kind of social support do you have?
Just
Your wife and kids? They're good support to you?
Mm-hmm.
How are you coping right now with your, you doing okay?
Yeah, well enough.
Okay. Do you feel safe in your home?
Yeah.
These are some personal standard questions I ask everybody. But have you been ever been violently or sexually, physically assaulted in any way or
No.
abused? Okay. Have you ever thought of committing suicide?
No.
Okay. What activities do you like to do for fun?
Hiking, camping.
Hiking and camping. Okay. And then, do you exercise?
Yeah, I work out 5 times a week.
You work out
usually.
5 times
Yeah.
a week? Okay. Do you wear glasses? Obviously.
Yes.
Do you wear contacts?
Yes.
Okay. Do you have any hearing aids?
No.
No. Okay. And can you confirm your height and weight?
Yeah.
Is that
that's
correct? And do you, what is your usual diet like? What does it normally consist of?
It's just typical American diet.
Do you eat like chicken and meat,
Yeah.
Do you eat
chicken
vegetables?
meat, vegetables, fruit.
fruit? Okay. And how much fluid do you drink in a day?
I try to drink lots of fluid, at least 5 or 6
Okay.
glasses of water.
Glasses of water. Okay. And then, do you drink alcohol?
No.
Do you smoke?
No.
Vape? Chew tobacco?
No.
Okay. Do you use any kind of recreational drugs?
No.
Okay. And how is your appetite normally?
It's usually good.
And then, since you've had this sickness, how has it been?
Not good.
0, huh?
Yeah.
And your bowel movements since you've had this, are they
They've been diarrhea 3 times.
okay? 3 loose stools. And your urine when's the last time you urinated?
A couple hours ago.
A couple hours ago. Are we both on the camera?
It
We're
was
at 8 minutes.
Dark and cloudy.
Dark and cloudy. Did it have a particular odor?
Yeah, it was smelly.
Okay. And your sleep. Have you been able to sleep since you had this?
Not very well.
Not very well. And let's do a 24-hour diet recall real quick. What did you have for breakfast yesterday?
Cereal and
Cereal with milk?
yeah, and
Okay.
peanut butter and jelly for lunch, and then
Okay.
an apple,
Okay.
and then hamburgers and potato salad
Okay.
for dinner.
Did you have any snacks?
I had some carrots.
Okay, great. Okay, Paul, I think that's about it. We've covered your health history, and now I'm going to sanitize my hands, and we're going to go ahead and move into the head to toe assessment, okay?
Okay.
Okay, thanks.